Good evening, everybody. Welcome to this Quest series. Today we are with Quest 1C, the third lecture in the series of Quality Management System. It is very important that if you need to follow these lectures in its continuity, you should go and listen to the first two lectures because they're all connected. We are streaming live from Kolkata, India. And today's topic is Westgard rules, application and interpretation. The aim and objective of today's lecture, basically we have seen how we handle control, how we get to know the kit mean and how we make the lab mean. But it is very important to understand the control which we are using on a day-to-day basis in our hematology lab, in our biochemistry lab, in our immunology lab, whether these controls are trying to give us any information regarding the quality of tests which we are doing. So the statistical analysis of these controls have a pattern, and this was read by Westgard, and he had come up with certain rules. Although these rules are very straightforward, but for people in lab medicine who have very little knowledge about quality management system, they appear to be pretty difficult. So today's lecture is primarily aimed in trying to cut the clutter in relation to Westgard rules. So before we get into the Westgard proper, just let's revise the salient features of what we had discussed last time. We talked about control, and we said that there are three basic control levels. The blue color is for the lower control, the green is for the normal control, and the red is for the high control. Then we had talked about these various symbols, IVD, CE, what is the importance of lot number, what is the importance of expiry date, and what is the actual potency of the control after it is reconstituted or it is opened, and what is the first party, second party, and third party control. We have talked in details about characteristics of a good control. Then we went and saw the kit insert of a control, and we showed you how a kit mean is basically derived and how we plot the kit mean on an LJ chart with the mean and 1 SD, 2 SD, 3 SD tolerance. We then went on to show you exactly how we make the lab mean and what is the importance of the lab mean, what are the limitations of a kit mean, and how we derive the SD, and then how we derive the coefficient of variation, that is SD upon mean into 100. Then how do we derive medical measurement of uncertainty by multiplying it by a constant 1.96. This was the salient points, and then we showed you how a lab mean plotted on an LJ chart looks like, with the mean plus 1 SD, 2 SD, 3 SD, and how we plot the daily control points and how does it graphically looks like. Now with this background, let us get into understanding the Westgard rules. Before we understand the Westgard rules, it is very important for us to understand. Before we understand the Westgard rules, it is very important for us to understand what are the various salient features or the preface to the understanding of Westgard rules. It is very important to understand these preface activities because certain terminologies which are used in Westgard rules, if we are not aware of their actual definition, we may not be able to understand the rules, and thereby we will not be able to interpret the rules correctly. So the first preface understanding of the Westgard rule is to understand the limits and boundaries. This is the LJ chart, and you can see this is the mean line, and this is the 1SD plus, 2SD plus, and 3SD plus. This is the limit of 1SD would be read as beyond 1SD. This is the limit of 2HD. Any control point on this line would be read as beyond 2SD. And this is the limit of 3SD. And any control point beyond this would be read as beyond 3SD. It is very important to understand the limits and boundaries of the LJ chart because terminologies and Westgards are all related to these limits and boundaries. So as you see this LJ chart here, you can see this gray line is the line on the area between the mean and the plus minus 1SD. Variations within this gray area is considered as an acceptable variation. Like you can see these points, these are within the plus minus 1SD and these are considered as acceptable. Any point which goes beyond 1SD draws special attention, and thereby these points are then analyzed separately. Similarly, points going beyond 2SD has also significance and needs to be analyzed separately. So when we are looking at the Westgard rules and we are trying to see the LJ chart, we need to see where the points are, whether they are within the boundaries of 1SD or whether they are beyond the boundaries of 1SD or beyond the boundaries of 2SD or beyond the boundaries of 3SD. This is the first rule which we need to understand in the pre-phase concept to understand Westgard. Second thing is trying to understand the implications of various controls. So we are using level 1, level 2 and level 3 controls. Now these are low, normal and high controls. We should know what is the implication of these controls vis-a-vis the testing which we are doing. So this is a graphical representation of the normal analytical curve. This is the simplest analytical curve, which is a straight line curve. And this is the analytical measuring range. So this has the highest limit of detection, and here is the lowest limit of detection. Now this analytical curve is absolutely in relation to the calibration curve which we make. So basically we need to understand that this curve has three components: the lower one third, the middle one third, and the upper one third. Now these three components represents the area of definition of the three controls which we use. The lower one third represents the level 1 control, which is the low normal. The green area represents the middle one third, or also represents the normal control which we are using. The red area represents the upper one third or the high level control which we are using. So whenever we see any anomaly of the controls, immediately we should think that this is in relation to the respective part of the analytical curve. So just to give you an example, so this is the analytical curve, calibration line. For whatever reason, maybe because of routine wear and tear and the uh, degeneration of the systems of the machine, this curve slightly shifts. So now actually we have this as the null curve instead of the original curve. So if we run the controls, that these controls, now if you look at it, the level 1 control is absolutely out. However, the level and the level 3 controls are giving values within their defined range because they are within the limits of this new curve which has formed. So in case if the lab is using only one level control, say level 2 or only level 3, the lab will not be able to understand any anomaly happening in the lower levels of activity. Thereby, all the which are below normal is likely to be released out wrong. So it is very important to understand that which control is trying to analyze which part of the analytical curve. This is the second part. Now we go to the third, which is the concept of runs and materials. Terminologies which are very frequently used in the Westgard rule. We need these all these terminologies. So these four terminologies which are very commonly used in Westgard are: first is within run, second is across run, then we have within material, and then we have across material. And many of these terminologies are used simultaneously in conjunction with each other. So what is within run? Within run is control run on the same day. It may be one level or maybe more than one level. So for example, here on day 3, we are running level 1 control as well as level 3 control of cholesterol. So this run is called within run. That means the run is on one day, that is the 3rd of June. So all the activities of the control on the 3rd of June would be considered as within run activity. It may be one control or it may be more than one control. Across run means comparing controls on subsequent days. These can be comparing controls of the same level or different level. For example, here you can see this is one level control which we are trying to see for consecutive 10 to 12 days. So this analysis is called the across run analysis, where you are trying to follow the control over a period of time. So because this is only one control, so this is of the same level. Similarly, you can have across run, where two different controls can be compared over a period of time. So for example, you can see here the level 1 control on day 9 and day 10 is absolutely fine, but the level 3 control on day 9 and day 10 is definitely showing a deviation. So this is called a cross-run con control comparison. Similarly, you can have within material, that is analysis of the same level of control over a period of time. So if only one material is being analyzed, it is called within material. And across material is when you are trying to compare one level with the other level. So here you can see we are comparing level 3 with level 1 on a specific day. So this comparison is called across material. When you are trying to analyze only one material, it is called within material comparison. But in practical terms, all these four terminologies are, you will see, it is within material across run. Sorry, some confusion technically. Please don't share your screen. So just to get back into the continuity, we were talking about across material comparison materials on the same day of two different levels. And as we said that these can be used simultaneously. Like here, if you see this graph, you will see we are trying to analyze only one material. So this is within material, and we are analyzing over a period of time. This is within material across run. So, and you see this one, you will see that it is being done on one day. So it is within run, and there are two materials. So it is within run across material. As you can see, because it is being done on the same day, it is called within run. And because it is two different materials, level 1 and level 3, so it is called within run across material. Now, for example, if you see here, we are trying to compare these two controls. So we are trying to do across material, and it is being done on two different days, day 9, day 10. So this is across material, across run. So this is the concept of using controls within material, across material, within run, across run. Now we come to the next and the most important part of Westgard is trying to understand the concept of error. Entire Westgard rule is based on error. Error is basically divided into two categories in the control run system. One is called the systematic error, or even called systemic error, or random error. A systemic error is error in the test system, usually caused by malfunction that affects all tests. While random error is an unpredictable activity which may affect one part of the control, and you may not be able to exactly find out the reason for this error. It is random. So let us see what is random error in definition or in details. Now if you see, basically the ideal situation would be that the control should always be on the mean, right on the central line. But that never happens. There is deviation, like I told you in the beginning, within the boundaries of plus and minus 1 SD. This deviation, although is a random deviation, you can see up, down, but because it is between the plus minus 1 SD boundary, it is called the acceptable random error. Once it crosses the plus 1 SD boundary, like here or here, these are unacceptable random errors. It is these unacceptable random errors which we are concerned with. Now, a random error is an error which varies in an unpredictable manner and cannot be accounted for by applying correction. So, for example, you take out a control and you run it in your system. It gives you a deviation of 3 standard. Now, that's a big error. You do nothing. You just rerun the same control again. Now this time it is within plus minus 1 SD. Now you have got no explanation as to why at the very first go when you ran, why did it give you an error of 3 SD? This is called a random error, an unpredictable activity which you cannot exactly account for the reasons. So this is a random error, and random errors are only the way to eliminate is by repetition. Examples of random error is error in pipetting, changes in incubation period, and these random errors can be eliminated by good training, using SOPs properly, and doing good machine maintenance. So whenever you see an error happening on one side of the mean, it is surely a random error. Now we come to what is a systematic error. Systematic error is one which remains constant and there is a definite pattern in the error. And this pattern can be easily understood and can be eliminated. This is a systematic error. So systematic error creates a characteristic bias and can be accounted for by applying a correction concept. Now the causes of systematic error can be calibration lot changes. You have changed the calibration lot, your calibration curve has changed, and then your control starts moving from one point to the other. If the temperature of your incubator unit has changed, of course your reaction has changed, so your results will change. If your light source is deteriorating over a period of time, so you will see your results are either going up or going down. So these are gradual activities which are happening on a day-to-day basis, and if you very carefully analyze them, you will be able to find out the reason. So this is what a systematic error is. The most important part is systematic errors are always in one direction of the LJ chart. This is something which you need to understand. On the contrary, random errors will be either on one side once and the second time on the next side. So systematic errors will be multiple points occurring in a gradual manner only on one side of the LJ chart. So this is a good clue to understand whether the error on the LJ chart is random or systematic. Systematic errors can be divided into two categories: trend or shift. Trend is something which is gradual in its nature. It is evolving gradually. And shift is something which is abrupt. Suddenly it happens. Say, for example, if you see this LJ chart, you can see that the control is gradually going up. From here, it goes up and up and up. And if we continue allowing this to go, very soon it is going to cross the 3 standard limit. So this gradual movement is a trend. For example, here you can see the level 2 WBC control is gradually falling. So this gradual movement from one point in a manner which can be very clearly understood and defined is called a trend. And what are the reasons of trend? If you get a trend, you have to look at these 8 points in your system and try to correct any one of them. Deterioration of the instrument light source. So the light refraction is slowly and slowly becoming lesser and lesser. So OD generation is less. So you are getting a low value compared to the original value. Gradual accumulation of debris in the sample and reagent tubing. This is the commonest error in hematology lab. The tubes which the hematology blood cell counters have, there is gradual deposition of whitish plaque. So this is one of the reasons for trend changes in hematology control. Gradual accumulation of debris on the electrodes. This is commonly seen in all electrolyte analyzers, the ones which are on ISC based. Aging of reagents, gradual deterioration of control material, gradual deterioration of incubation chamber temperature, especially in enzyme chemistry and biochemistry, gradual deterioration of light filter, especially in flow cytometry, and gradual deterioration of calibration. This is commonly available for most of the biochemistry parameters. So if you are getting a trend on your LJ chart, you have to look for any of these or a combination of these factors which needs correction. Now we come to shift. Shift, as the name is clearly defined, is an abrupt change. It's a shift in QC in a sudden and dramatic manner, which can be in the positive direction or in the negative direction. For example, if you see this LJ chart, you will see that there is a nice mean and across an acceptable random error, and suddenly on day 7th, there's a jump and the mean shifts from here to here. It's definitely something is happening on day 8th, and this has resulted in a sudden change in the control activity on the LJ chart. So there must be something which has changed here, which has resulted in this shift. So what are the causes of shift? Sudden failure of change in the light source. If you put a new light source, the intensity of the light is high, immediately the entire picture of the control will change. If the reagent formulation is changed, if you change a new lot of reagent, of course, you have to understand, remember when I told you control is lot dependent. Major instrument maintenance, every time there is maintenance of the instrument, the mean SD will change. Sudden change in incubation temperature. Very important thing which many people don't realize is change in room temperature or humidity. This is very common in hematology, particularly labs which are handling P-time, APTT, thrombin, all the coagulation profiles. If your coagulation control is not doing good, please check your room temperature. This might be a cause for the shift and sudden shift in your LJ chart of your coagulation profile. Failure in sampling system, if your pipettes are not properly calibrated, failure in reagent dispense system, inaccurate or recalibration. These are the 9 causes of shifts. So if you see a shift in your LJ chart, you try to look for and try to remove them, and this is very important for you. For example, if you look at this LJ chart, you can see this is gradual movement on the positive direction. There's a trend which is going up. Here we need to analyze all the causes for this trend, all the 8 causes. And right here on day 9, there's a sudden dip and a new set of pattern develops here. So this is a trend and this is a shift. And from here, we get a new pattern. And right here, again, you start seeing that the control is gradually falling. And this is again another trend here. And from here, it jumps back. So we have one shift here and one shift here. So if you look at errors, we have systematic errors and random errors. Systematic errors is because of poor accuracy. There's a definite cause and it is reproducible and it can be corrected. Random error has a poor precision, it's non-specific, non-reproducible, and cannot be corrected. Now we go to the last part of the preface of Westgard, which is concept of operational pathway. We all need to understand the operational pathway of our control and our work system to understand exactly where mistakes can happen and what needs to be corrected. The most important is the cold chain management of the control material. From the time you procure it from your vendor, the way it reaches you, and then when you refrigerate it, when you take it out, how many times you are taking out the control, and how many times you are thawing it, and then again putting it back. This is very important for the integrity of your control. And if your control is failing, you need to go back and look at your cold chain management. This is the commonest cause of systematic error. Poor cold chain management of control material. The next is if you are constituting lyophilized control, liquid stable controls which you are trying to do aliquoting, you have to understand how properly you are reconstituting, what is the nature of water you are using, what is the calibration of the pipette with which you are reconstituting. The handling of control material is very essential. If you don't do this, it's bound to have systematic error. The third part is, as I told you earlier in the last lecture, with time, the potency of the control material gradually starts falling. And that is why it is very important to write on the control material the day of opening of the control material. So gradually and gradually, the control material potency starts falling, and there's a pattern you can see, there is a trend, and this is very typical of systematic error. Machine calibration and maintenance. You need to calibrate your machine frequently and go do good maintenance of your machine. If you have improper calibration, there is highly likely to have systematic errors. And if your machine maintenance is not good, then you are likely to have random errors. If you're getting random errors very frequently, your machine maintenance is not good, its pump is not functioning properly, or its suction material is not doing well. But if you're having very systematic errors, which is either a trend or a shift, look at the calibration of your machines. It needs to be sorted out. This is a very important part which many people overlook: water and electricity. Water in relation to biochemistry and immunology, and electricity in relation to hematology. Nowadays, most of the random access analyzers are using direct water. So the conductivity of the water is very essential, and it should be less than 1. So many a times we have errors in our control and we are unable to exactly attribute it to a cause. Go and check the water conductivity. Many a times this is the reason for random error. In electricity, in technology, we always try to use UPS. It is more important to understand that along with UPS in hematology, you need to have a CVT, continuous voltage terminal, because most of the hematology machines work on electrical impedance. and potential different activity. If the electrical current source is not stable, you are likely to have a lot of anomaly, especially in your platelet count, in your PCV, in sometimes in your hemoglobin. So for all hematology activities, not only you need to have a UPS online, but along with that, the output should be connected to a CV to have a continuous stable voltage into the machine system. And this can result in random errors if not looked at. So with these 5 points in trying to understand the various activities in relation to Westgard, I think we are now ready to get into the Westgard rules. Westgard rules was developed by Dr. James O. Westgard in Wisconsin, America, and he analyzed the data and realized that there is a pattern, and if you understand this pattern, you can say whether your run is in control or out of control. So by running and evaluating the results of two controls together, trends and shifts, I think by now you must be knowing the definition and understanding of trends and shifts can be detected much earlier, and based on this and using a pair of controls, Dr. Westgard had come out with Westgard rules. So there are 6 basic Westgard rules, and these rules are used either individually or in combination, mostly in combination. Except for one or two rules, most of the rules are applicable in combination. So you need to understand each rule individually and then how in combination does it work. So what are the 6 Westgard rules? So these are the 6 Westgard rules: 1 2s, 1 3s, 2 2s, R 4s, which is also called the reciprocate 4s, 4 1s, 10x. One thing which you need to understand is the prefix 1 stands for the numerical value of the control which is deviating. If one point is deviating, it is 1 2s. 2s means what standard deviation it is crossing, which boundary it is crossing. So 1 2s means that one point is crossing the 2s boundary. 1 3s means one point is crossing the 3s boundary. 2 2s means 2 point is crossing the 2s boundary. Reciprocate 4s means 2 2s on one side, 2 2s on the other side. 4 1s means 4 point is crossing the 1s boundary. 10x means 10 point on one side of the mean. So now let us see these rules in details and let us try to understand what each rule has its implication. So as you can see, the first rule 1 2s. So that means 1 point is crossing the 2s boundary. Remember I told you about the limits and boundaries. So if you look at the LJ chart, you can see this point. It is beyond the 2SD boundary. And since this is 1 point on one side and there is no other pattern, this would be considered as a random error. But please just don't understand this as random error. If these points continue on the side, then it will become a systematic error also. So 1 2s a random error, or a beginning of a systematic error. So this is just a warning rule. If no other abnormality can be seen around, like you can see in this LJ chart, all the points are fine except for one point here which has crossed 1 to S. So this is a random error and we will ignore this. It will just give us a warning that one day something went wrong and your control value has just crossed 2S. So it warns that a random error has occurred or a beginning of a systematic error may be in progress. If there is no relation with this value with any other value, patient report can be released and this can be considered as an acceptable random error. Second rule, 1-3S, meaning 1 point is beyond 3 standard deviation. You can see here 1 point has crossed the 3 standard deviation. This is an unacceptable error. If you get 1-3S, you have to stop your work. This is something which is not acceptable. Results cannot be released. So 1-3S is considered as a rejection rule. Now you need to go and try to find out the cause, do the solution, and once that is done, rerun the control. And if the control is within the 3SD, only then you can proceed. Otherwise, you cannot proceed unless corrective action is taken. We come to the next rule, that is rule 3, which is 2-2S, meaning 2 points has crossed 2 standard deviation. Now you can see here on 2 consecutive days, this control value has shown 2-2S deviation. So there was a 2S here and then another 2S here. Now since there are 2 points on the same side of the mean, remember the rule which I told you earlier, this is a systematic error. And now let us try to understand what are the variations of 2-2S. Now 2-2S can be applied within run, across run. Now you understand these terms well. Within run means 2 different controls run on the same day. Across run means same control run on 2 consecutive days. So let us see this. You can see here, this is level 1 and this is level 3. On 3rd of June, level 1 gave a 2SD deviation and level 3 also gave a 2SD deviation. So there were 2 2SD within the run across material. This is a systematic error and this is a rejection. So you cannot go ahead with this. So if you get that, it means that the analytical curve, both the lower 1/3 and the upper 1/3, both are getting affected. So if you see, level 1 is also affected and level 3 is also affected. So your entire analytical curve is in suspicion. So all your results, whether it is normal, below normal, or above normal is likely to be having a bias which can be wrong in critical areas. So you cannot release this report. So we've seen the within run across material. It can also be a cross run. Now you can see here we have this level 3 control which on 2 consecutive days is showing 2SD deviation. This means that the analytical curve only on one part is showing an error. By if you analyze that the higher levels of results are not reliable. So this is also a rejection rule. So we have to be very careful. So it is very important to understand SD can be within run across material or it can be across run within material. And its implication on the analytical curve we can understand. We now go to rule 4, which is called the reciprocate or the reverse 4S. As the name suggests, you have one 2S in the positive direction, another 2S in the negative direction. You understand this rule very well. This is within run across material. That means on day 14th, the lower level control shows a negative minus 2S, while the higher level control shows a positive 2S deviation. So it's reciprocating on 2 different directions of 2S, and this is called R4S. It has the same implication as 2S. Only thing is that because it is on opposite, this is a random error and it is affecting the entire analytical curve. This is also a rejection rule, meaning to say that your control system is not at all in its robust state. So you need to really check in. That is one control giving a negative bias significant and the second control is giving a significant positive bias. This is a random error. Rejection rule. The fifth rule is 4-1S. As 4 means 4 points beyond one standard deviation. Now, as you can see here, there are these 4 points which is beyond. This is the 1S boundary, and you can see 4 points which are beyond this. Now, because this is not an interactive class, otherwise I would have asked you whether this is within run or it is whether it is within material or it is across material. As you can see, the time span is 4 consecutive days. So this is an across run. And since this is only one material, so it is one material. So it is within material, across run, 4 consecutive points on one side with 1 SD deviation. So this is 4-1S rule. Now you can have a second part of 4-1S rule, which is across material. You can see here in the lower control on 2 consecutive days, there is plus 1 SD deviation, and on the higher control on similar 2 days, we have had plus 1 SD deviation on 2 consecutive days. So if you put them together, you can see 4-1S violation across material, across run. This is also a rejection rule, and generally it is studied in conjunction with other rules. Now you can extrapolate this on your analytical curve and try to see that even the lower one third and the upper one third is showing a positive 1 SD bias. So most of your results which you are releasing of your patients will be on the higher side. So wherever there is a criticality, particularly in critical values like potassium, say in prothrombin time, in creatinine, where the borderline activity is very low, there is highly likely of giving a false positive result. Now we have discussed this control levels across. Now we go to the last rule of Westgard, which is 10x rule. As you can see here, SD is not mentioned. It is not mentioning 2 SD or 1 SD, or it is talking about X, meaning 10 points. That means if you have 10 consecutive points on one side of the mean, it is called 10x rule violation. This is not a very serious rule violation. It is trying to tell you that there is a systematic bias. Probably you are using a wrong mean. And if many a times when you are trying to use the kit mean, this may be actually your lab mean which is coming up, and your mean is not in relation to your lab activity. So if you generate a lab mean, you will see that the mean will shift from here downwards, and this will be corrected. One thing is very important to understand: this 10x rule is not applicable in most of hematology activity. The reason behind that is many times the hematology control has potency of only 14 days. So it is very difficult to generate a lab mean. So many a times we have to work with kit mean. So in kit mean, it is very likely that you may have a 10x deviation, which actually may not be an error, but represents the lab mean generation in process. Another aspect of 10x rule is across material, where one control, that is the lower control, is showing 5 points, and the level 3 control is showing 5 consecutive points on the same side of the mean. As you can see here, the lower control is having 5 points on negative SD, and similarly the higher control is having 5 consecutive points on the negative SD. So this is called 10x rule across material, across run. This is a systematic error, and in biochemistry, this basically means that the lab mean needs to be rectified. Now let's come to what are these rules and what do they detect in simplified manner. So 1-2S is a warning rule. If it is not accompanied by anything else, if you get 1-2S, you can release your report, do an internal checking for any corrective issues, but it is not going to affect your results. 1-3S is a random error and a rejection rule. 2-2S is a systematic error. R4S, because it is across the mean, it is a random error. 4-1S on one side of the mean, again systematic error. 10x is a systematic error. Now, how do we read these? Before we do that, let's just have a quick revision. This is 1, 2s here, and what is this here? This is a 3s. That is, this is a rejection rule here, and this is a warning rule here. This is 1, 3s here. This you can see 2, 2s, a cross run, and 1, 3s here. This you can see 2, 2s, across material. This is R4s, cross material. This you can see a bias on one side. This is 10x rule within material. And here you can see R4x here, 1, 3s here, 2, 2s here. So multiple activities going on this chart. This you can see 4, 1s rule here, violation, 1, 3s here, 2, 2s here, R4s here. And this is a typical bias which we showed you, 10x rule. Now this is a very good algorithm which most of us use in trying to understand the LJ chart. This is very simple and self-explanatory. If you see, if you run the control and you get 1, 2s, and there is no other issues in control except run. If you get 1, 2s, along with that you get 1, 3s, it is out of control. If you don't get 1, 3s, and you get another 2, 2s, so 1, 2s plus 2, 2s, so it's out of control. If you get along with 1, 2s and R4s, again it is out of control. If you get 1, 2s, along with that you get 4, 1s, it is a rejection rule. So we can follow this algorithm, read the Westgard rules on the LJ chart, and try to analyze whether our control is in control or it is out of control, whether we accept the run or we reject the run. This is a very good table which is very handy for everybody. It gives you the rule, the definition, the type of error, and what you need to do, whether the patient report can be released or it should not be released. I'm not going to read through this. This will be available on the PDF, so you can go through this. So we will stop here because now we have done up with the Westgard rules. In the next lecture, we will try to talk about solving out of control problem in practical. Suppose we have a 1, 3s deviation. What do we actually do? We will also talk about, suppose we run a control in the morning at 8 o'clock and it is fine. And in the evenings at 4 o'clock, 5 o'clock, when we run the second control, this control is not fine. So what remedial action do we need to take? How do we need to go about? And how do we need to solve the problem? So that will be our quest 1D. The upcoming lecture this Friday is our first of our Pursue series, where Dr. Indranil Das, a very famous pathologist in Calcutta, he will be talking about adult renal tumors, grossing, microscopic approach, choice of immunohistochemistry, and molecular markers. This is on 10th July, 7:30. It will be live on Google Meet and will be live streamed on YouTube. Some people had asked exactly how they should approach these lectures. My advice would be for the newcomers, Please read basic anatomy of kidney and basic histology of kidney. That is all. The rest will be covered by Dr. Indranil Das, and we will go by our philosophy. We will go slowly. We will take time in trying to make you understand everything, and it will be 1 hour talk. If in 1 hour we are not able to finish the subject, it will be carried forward to the next day. Thank you so much. See you next time. Bye bye.